Sorry. Hi all, thank you so much for joining me today. In today's video, I'll be talking about communication skills for IMG doctors in Australia, and this is just a guide that I'm offering for doctors that are international medical graduates to help them navigate the Australian healthcare system. So communication generally is used by a lot of professionals, a lot of, every day today you use communication to be able to pass some information from one person to the other. So I believe that this video is important for anyone that's listening to me today, because it will offer you some tips on how to navigate, the hurdles that come with communication. So in this video, I'll specifically be defining what communication is, especially in the context of IMG doctors, and then I will be describing when and where you would normally require these skills to in a big way, and then I will describe some of the challenges that are faced and have been documented to be faced by international medical graduates in this space. And then eventually, to finish this off, I'll be talking and offering my tips on how to navigate these challenges for IMGs. So sit back and listen in. My name is Anna, and migrant Dr. Mom, and thank you so much for being here. So what is communication? In simple terms, communication is just essentially the art of passing information from one person to the other. This can be communication skills that are written, so that would include various things like emails, memos and stuff like that. And then there will be the written, the verbal communication skills. And where verbal, obviously, as part of the communication skills, there is obviously the verbal and the non-verbal skills that you need to learn as an IMG doctor. If you notice that communication skills form a big part when you look at job descriptions and you look at the selection criteria, and these are two important documents that are very, very important for an IMG, especially when you are at that point of applying for a job. You will notice these two. Sometimes they add in the cover letter, but the biggest would be your resume and your selection criteria. You will notice communication skills forms one of the vital, desirable skills that you are expected to possess as an IMG doctor hoping to work and live in Australia. And because of that, I believe that everyone should have a bit of knowledge and skills in this specific area, because you'll use it day to day. And when I say you'll use it day to day, it's a skill that is highly regarded. It is a skill that is an important component. And even if you look at things like domains of various specialities, like, let's say various domains of general practice and stuff like that, communication features quite highly in that aspect. So it is a skill that is important. It is a skill that you have to master, and is a skill that I am only hoping that can give you a bit of confidence when you start to navigate the Australian system, which can be a bit overwhelming, especially in the first months of you settling in Australia. And in my own personal experience, it is a skill that I had to quickly adjust to use it to enable me to settle in even easier and quicker. So at what point are you going to be expected to use these communication skills? You will notice these communication skills will start way back when you start to do your applications, okay? When you start to put in your paperwork and everything like that. But importantly, so it will come at the position where you start to try and get your job, when you're seeking for a job, you will require these skills, especially the written skills, at that point in time when you are applying for a job. I was listening into a professor who sits in most of the selection panel for picking up. Remember, when you're applying for a job, there are so many applicants. Already you're disadvantaged by the fact that you're not an Australian graduate. You are already starting off at a point where you are competing against so many other applicants, so many other people from other countries who are also IMGs. So at that point in time, remember, you need to be able to secure yourself and be shortlisted for an interview. And before these people look at you or know you, they will be looking at your paperwork, and your paperwork in there will be you telling them, trying to tell them what sort of a person you are, your skill set, your previous experiences. They need to use that document to be able to know what sort of person you are and whether you need to be given an opportunity for an interview. And that's where your written skills will come in handy. This professor was talking about people actually writing in there, they have excellent written skills. But you look at the papers and you see spelling errors, you see formatting errors, things that you can easily use a friend to review, or you can use one of the, the apps to try and see if you've actually, written your tenses right, you've written the spellings right and all that. So very important at that point in time to put your best leg forward by ensuring that your initial paperwork, that's your resume and your selection criteria is so well done in written context, meaning that you've explained who you are, you've explained your skills, your paper is making sense in terms of what and tying up to your job description. So you'll notice you lose that at that point in time. You lose your communication skills when you start working, when you're on the floor. When you're on the floor with your colleagues and all that, you'll need to be able to talk between colleagues. And by that, I mean your senior colleagues and your junior colleagues. You need to be able to talk to other staff in the hospital. That's the nurses, that's the allied health, that is the support staff in the hospital. You need to be able to have a language and a communication skill to be able to meet people at every aspect of your working career. So it's very important to know that this is important. And I cannot forget that you will need to speak to families. You'll need to be able to speak to patients themselves and be able to explain yourself and be able to pass that vital information between the various parties. So those are some of the places that you'll be able to use your communication skills. The other thing, the place that you'll be able to use your communication skills is when eventually you're called for interviews as well. That's another big area that you will need to either use, your skills as well. And I have, a whole video about interview tips and how to ace your interview. So yeah, I put a link for that as well. So there has been a survey that has been done by Australia Medical Council that has looked at various international medical graduates, and I think about 4,000 IMGs were surveyed. And in that survey, part of the questions that were asked were, what are some of the challenges that IMGs face? And top on the list was the issue of communication, as part of the challenges they face, especially in the Australian sort of cultural space, culturally acceptable communication that is geared towards the Australian population. We come from various countries as IMGs. We come from countries where we speak different languages. We speak, some people speak even not English speakers. So when you come to Australia, naturally, you're expected to speak in English, and obviously you'll do your English test and all that. But where the rubber meets the road is where now you are in that context where you now need to use those skills on a day-to-day. And part of the challenges that were cited by the IMGs is the fact that English comes off naturally for some IMGs as their second language. So sometimes when you are explaining things to your patients, part of you, even myself, there's sometimes some things I'm not able to, like in my head, I'm almost thinking in Swahili or something like that. And then somehow I'm able then to express that in English. And also, apart from just language not being your first language, there are other things like cultural differences, Here in Australia, one of the things that really hit me quickly when I came to Australia was how Australians are laid back, and how, even everybody, patients, they're quite laid back. And one of the things that I struggled with is things as simple as terminology, Where else I was used to saying urine, these guys say urine or they say waterworks. So when you're going to talk to a patient and you're asking them about their history of have you passed stools and stuff like that, it's have you passed your bowels, have you opened your bowels? How's your waterworks like? Are you getting any, there is that sort of language that somehow, however well you prepare yourself, you just have to learn on the job. There's some terminologies that are used, in the health space here in Australia that by and large are not like English, but that is just how culturally or how socially Australians relate. They have this interesting way of they'll rub something off you, and one of them will be something as minor as, they will throw in a joke, and sometimes you don't even get it, and then they just laugh. So you, at that point in time, you're not sure, should I laugh as well? Am I, laughing inappropriately? Or instead of saying yes, I'm here smiling, or saying no, I'm here like just looking lost. And to be very honest, some of those things are just things that you will have to learn as you go along. And you will have to acknowledge within yourself that these are challenges that you're likely to face. And so you need to learn how to maneuver them as well. And then the other big challenge faced by IMGs in the area of communication is lack of, especially if you lack the structure. Structure is key. I remember when I started here in Australia, in your head, med school and all that, you're taught how to start off, your history with presenting complaint, the complaint itself, the history of presenting complaint, and then maybe you look at the background history, and then you look at allergies, the social history, and then you come up with a plan. But sometimes when you are in an emergency department as a junior and you're talking to your boss, obviously you'll have gone through all that. You still need to come up with that structure. And I'll be talking about it when I'm giving you some tips. You need to come up with a structure of how quickly you will be able to pass this information to the other person. So they see it, number one, they see the urgency of the presentation. They are able to realize whether they need to do something quickly or they can give themselves some time. And then importantly so, you need to be able to generate a plan by that person, you speaking to that person before they even go to the bedside of the patient. And I used to notice that sometimes if you've not done a good job, your boss will sort of just get off the chair and go retake the history all over again. And that can eat up a little bit on your self-esteem. And that's something that I wouldn't want any of you guys to have to go through. If you can learn the structure, when I talk about some of my tips, if you can learn the structure and develop it and get your own structure that you will use day to day, you'll be able to successfully implement it, to be able to communicate with your seniors so they can make decisions without having to grudgingly get off the chair and redo the whole thing all over again. It's frustrating for them, but it is frustrating for you as well. So that's some of the things that I'm going to tackle. The other challenge that has been faced by IMGs in the past is the difficulty, especially when getting feedback. Feedback in Australia is part of a junior doctor's life. You will need to get feedback from your bosses at whatever stage. And at this point in time, it can be very tricky, especially if you're getting feedback that you did not anticipate. And sometimes that feedback is given in good faith, but without, proper, our culturally sort of proper, especially if you come from a country where you cannot question your boss. And by questioning, I'm not saying you're insubordinating them, but you're just seeking clarity. When you say, I am not hardworking, what do you essentially mean? And they are, ideally, somebody's supposed to give you specific example. Like, for example, last shift you did 1, 2, 3, and 4. I believe, your safety for patients is not excellent because last time you had a multi-trauma patient and you only did an x-ray of the hand, you did not assess the other important things. So feedback can be an area where IMGs can sort of struggle. First, because they don't know that they can actually, it's supposed to be, before you allow people to sign your APRA paperwork, you need to be able to have that back-to-back discussion and learn. And one of the things that I quickly learned when I started working here is a lot of times they would put very positive attributes about my performance, but I would always ask, is there any place you think I can improve? Is there any place or any domain, or is there anything, any advice you could say that I could do better next time so that I improve myself as an individual. So I find that to be very, very important, as much as it can be very confronting, but it is an important area where you will need to use your skills to be able to know how you're tracking along, because you don't want to go through your entire term and at the end of it all you realize you didn't do well and you have to resit a term. You better get onto it nice and quick, because there's something like that, obviously, my dear IMGs. There's some times where people go through the entire term and at the end of it they're told you have to redo a term. Imagine the stress that's going to put on you and by extension on your family. So in this next section, I'll be talking about some of the tips that I want to give that can assist you in your communication skills. And like I always do in my videos, I use my personal example so that you know that I've gone through these things and I have learned a few things, and I would want you to learn from what I have learned so that when you come, you're starting off on a good plate. Because I know if not properly done, there's always that chance that it can affect you going forward. So what's my tip number one? Need to remember that communication is an art. It is a skill. You have to develop that skill. You are starting off because you're an excellent doctor. You're already a doctor. It means you have the skills, you have the attributes in you of being a doctor. You're somebody that cares about patients. You're somebody that knows how to manage the patients. But being a skill that you have to develop over time, obviously using feedback, obviously using experiences you've experienced in the past. One of the things that I quickly learned when I came to Australia that was very helpful for me is learning and a structure. I have over time developed my own structure, because you cannot use another part. You can learn from other people's structures, but at the end of the day, you need to develop your own structure. Commonly, the ISOBA, where, ISOBA will definitely tell you, things that you need to look at, when you're assessing a patient. You look at the situation of the patient, you look at the vital signs, and then obviously you come up with a plan. I have found that when I see my patients and I've written my whole long document and I'm handing over to the other person, I'm trying to get a patient transferred from one hospital to the other, I find starting off your descriptions by something like, I am hoping to speak to you about a patient that I'm worried about. Or you're talking to a boss on the other end of the phone call and you're on night shift or you're on after hours. You start off by saying, I'm calling you because I'm worried about so and so. Or I'm calling you because I would like an opinion about so and so. I'm calling you because I am hoping to admit this patient and I'm hoping you can look after them. So having your way of like an introductory message, obviously you'll have to say, my name is so and so. I am one of the registrars, or I'm one of the GPs, or I'm one of whatever it is that you are, calling you from this specific hospital over this patient. And the reason why I'm calling you is because I'm worried about them because of 1, 2, 3. So come up with your own structure. Okay, and then you can go ahead and say, this person that I'm worried about is a 78-year-old gentleman that came in with 1, 2, 3, and 4. He's had a fall, he's on blood thinners, and I believe will require a CT scan because he's on blood thinners. His vital signs are 1, 2, 3, and 4. And this is my assessment, 1, 2, 3. This is my plan, and is there anything you would like me to do, either differently or something that you'd like to add on? Because remember, at the end of the day, you're calling as a doctor to another doctor. So you need to have your own mind as well, and then you're getting additional information. In my experience, I have learned that sometimes, when you're starting off as a junior doctor, especially if you've worked overseas, you have that sort of self-doubt that sometimes you're wondering, if I give my plan, am I doing the wrong thing? And I can tell you from experience, don't just call a boss and say, patient has had a fall. What should I do? No, you are a doctor. Say, this is what I'm thinking of doing, or this is what I have done. Is there something else you would want me to do? Or is there something else you would want me to do differently, or something like that, okay? When you're handing over cross hospital to hospital, say, this patient came in 3 days ago, has been on treatment for so and this and this. We are worried about him because he's in shock, or we are worried about him because he's not getting better. We are worried about him because he will need a multidisciplinary approach that we do not have. So I find if you hit it hard right from the word go and explain to the other person what you're talking about, it sticks in And most of the times people will help you. Okay, and it will run off really, really well with your colleagues and your seniors, because they know that you are thinking, you're a junior doctor, yes, but you're thinking as a doctor. Okay, so that was my point number one. You need to learn the art of doing it. You need to develop your structure. Structure is very key. Regardless of what's thrown your way, as long as you have structure, you'll do it. Okay, number two big tips that I have learned over time is you need to know who is who. Who is who? And this is even back in my country. That was the same as an intern. You would need to know who's going to pass you the term, who's going to fail you the term. You need to know which nurse has power to change opinions on other doctors, has power to say nasty things about you, has the power to say good things about you, and in totality be able to help you pass a term or not. Very, very important. And if you've watched my video of my first day at work and stuff like that, I say in there, I was given an opportunity to go right into CCU. I'd never worked in CCU before, but I was still a doctor. And regardless of, my inexperience in CCU, I was able to know who's who in CCU, like the coordinator. She was very lovely. She was extremely, extremely lovely. This lady would come to you and say, I'm just wondering whether we should give some, this patient is in atrial fibrillation and the potassium is like 3.4. I'm just wondering whether they will benefit from some potassium. When she says that, that's what you need to be doing. That's what you need to be optimizing. So you will notice you need to know who will be able to help you in your job, and who can actually help you, and who will not, will help you but still bad mouth you, because there's something like that in Australia as well. People that will help you but then will speak behind your back about it. So you need to know who you can be vulnerable to and who you cannot be vulnerable to as well. So very important to know who's who and seek help from who you think will be able to help you. Number three is learn to speak up as well. Learn to speak up, and especially if you know an answer to a question, or just participate, in journal clubs, in whatever thing that you're doing. And the more you speak up, the more you'll get the confidence to continue speaking up. The more you hand over, the more you get an opportunity to learn the art of doing it. So just keep doing it, baby step by baby step, whether you're afraid or unafraid. And I will always say, another tip that I forgot to put on there, but I'm adding now, is the fact that when you're doing your handover, don't just put it in mental. Mental is good, but write little dot points. So I'll talk about the age, I'll talk about when they came in, I'll talk about blah, blah, blah. And then, practice it in your head. This is what I'm going to say. And then eventually say it. And before you realize it, you'll have learned it so much that you may not actually have to put everything down. You may just have to have this and this opened up, and then you just quickly go in. And that's something that obviously you will learn over time. Okay? And the other thing that I must say is a tip is, when you are getting feedback, remember to ask for specific examples. Ask, do not be afraid to ask, because remember, as soon as you pen down your signature on that Rig 30, that, APRA paper to say that this is your end of term, whatever your boss has said, as soon as you sign it, it comes to be. I'll give you guys a typical example. One of my terms when I started working my first year, I had a bit of mixed reactions about the term. In my opinion, I thought it was a good term. I was going well. Patients love you. The nurses love you. And even at one point, the last day that I was getting feedback, I found a patient, because I'd run after the boss, but the boss had come back. And I found actually the patient giving really good feedback about me. But that's the day I was doing my end of term assessment. And when I went and was talking to my boss about my end of term, there's one of the things that they had marked me down. And because of the fear, you're just new and stuff like that, I didn't know that I could actually, speak up for myself and say 1, 2, 3. Because at that point in time, I felt I was doing very well. I was going I was tagging along with him to do some things that my colleagues were not doing. I was going out of my way. And in fact, at some point, I sat him down and said, would you like me to come in, a bit earlier and stuff like that. And even those discussions that we had eventually caused there to be significant change in that department. So in my opinion, I thought I was doing really well. I was making, we were bringing up change in the department and stuff like that. But at the time of the assessment, it didn't think like he had thought like that. His thought process was completely different from mine. But at that point in time, I just signed off because of, the fear and stuff like that. But in retrospect, I look back and I say I shouldn't have. Obviously, it did not negate, it wasn't a very bad thing. I mean, it was satisfactory because everything else was, and all my other terms were like, either 4 or 5. This one was a 3 in one specific section. And then obviously I spoke to my supervisor with APRA and we talked about the issues and stuff like that. And obviously feedback from staff was excellent and stuff like that. So imagine if that wasn't the case. If that wasn't the case, who knows what could have happened to me for that term. So very important to take time and, just get feedback. I know you will be nervous. I know you will have just started work. You don't know. There's a thing like that in Australia. You can actually do. You're expected to do it. You're expected to have a chat with your bosses and stuff like that. And as I finish, I want you to know that it can start off as difficult, but I want you to know that you will grow. Your communication skills will get better as long as you're willing to put in the measures to try and make them work. If you're unsure of something, by all means, ask somebody else, to look at your notes, ask somebody else to look at your CV, ask somebody else to look at your resume, get somebody else to give it a second look. And I can assure you, regardless of whatever space you're in, communication is something that you're going to have to use every day. And it is something that you can learn and make yourself better by working on it every day. You have to work on it. And I'm wishing you the very best, even as you settle in Australia and as you learn the system and as you continue to grow in the area of communication. Thank you so much for watching. If you're finding this content beneficial to you, please share it. Let's grow the channel. Let's help much, much more people. Thank you.